Great. We have a question or comment.
We got lots of questions from our audience, our remote audience, who are big fans of this format. Naam Kowalski asks, how do they identify patients between systems? What is the unique identifier?
Actually, what we do in our system, rather than using an electronic master patient index, we have patient matching algorithms, and we've developed those so that you're instantaneously matching a patient, and then once you're done looking at that patient, it dissolves. But we match across vaults. What we do within our system is each participant, so if your physician's office was a participant, and then a hospital was a participant, and then some other participant, each one of your data is in a vault with your patient identifiers, and then we have a patient matching algorithm that brings all of that information together to display.
Oh, great. So that's kind of getting into the health information exchange type of concept that we're hearing a lot about here this week.
Yes.
And we have another question from emergency room nurse Kim. She is asking if it's possible to have physician office patient med lists accessible from emergency departments, because this is a huge issue with her patients who often say, my doctor has a list of my meds, but I don't.
Right. Actually, there's two different things that we solve in that. Most med reconciliation, especially for older patients, is when they bring your bag in to you, right, doctor?
Exactly, yep. I get the bag every day. Exactly, right.
Through it, and you say, well, you're on this and this, right? So what we do is we bring that information together from all of those sources, and then we have a med reconciliation module within our software, and we bring all of that together so that you know all of what they're on, what dosages they have, and it's visible within the emergency room, within the primary care setting, within the acute care setting.
Great. More questions?
Yep. Next question is about how does this differ from unifying systems like Health Vault, which is also trying to bring data together from multiple systems?
Health Vault is really more of a personal health record. So it's a patient-centric, patient-maintained healthcare record. What we're doing is actually bringing the health information within a community that is already out there in many electronic systems, but is really like a paper system, right? Each one of you have your own medical record that's not really shared. So what we do is bring that together. Now, what we also do is we integrate with PHRs, so that if you're on Google Health or Health Vault or any of the other PHRs that are out there, then we can exchange data from that so that patients can actually, say you put somebody on a hypertensive med and you wanted to know how your patient was doing and said, I want you to take your blood pressure twice a day. They can put that in the PHR. That would then be in the record that you could view. And then you could set a reminder for yourself to look at that patient in 4 days from now, view their blood pressures, and make sure that their blood pressure medicine was acting correctly.
Great. Other questions?
We have an interesting comment. In the chat room, they're talking about how in their dreams, it would be great if the med list were available on a phone so that the patient could access the unified med list when they're in the ER. Is that happening, or do you know anything about that kind of approach?
I don't really know anything about that kind of approach. However, most of our clients, in fact, in Memphis, we have a health information exchange in Memphis and in St. Louis. And both of their target audiences were the emergency rooms and the safety net clinics, the federally qualified clinics, the community healthcare clinics. And so their exchange began within those settings and then rapidly is expanding beyond those when they realized the value there. But each one of the emergency room physicians, admitting nurses, all of the folks that are in there have that portal view, so they actually see their med list, they see their most recent lab tests, they see their most recent radiology or any other diagnostic tests that they have.
Great. Other feedback from our friends in the chat room? So in our closing moments here, why should hospitals consider ICA for their solution?
Well, I think ICA is a very flexible solution. We take both structured and unstructured data, which I think is pretty unique within the system, and then we can re-engineer that data so that it can be standardized and passed on to other places. We try and multi-purpose the data that we receive so that it's visible in as many ways as possible, and our implementation methodology garners clinician ownership. We really try as much as possible to involve clinicians in the overall process, to take it as a clinically driven project rather than an IT project. And we've had very good success with physician adoption with our application. So I think that's where we're unique.
Great, great. So for people who are on site here at HIMSS, where can they find you? And for people who are watching us on the internet right now, where can they find you on the internet?
Okay, our internet address is www.icainformatics.com, and our booth here is 8309. We're in the B Hall at the very extreme right end. So we're always available for you to contact us through either the web or give us a call. And our number at our office is 615-866-1500.
Great, great. So we've been talking with John from the Informatics Corporation of America. Thank you so much for the time.
All right. Thank you very much for allowing me to speak to your audience.
Great. And Better Health's coverage here live at HIMSS 10 will continue in a few moments. We'll be right back.